Because of lockdown, the business which was existing as healthcare or diagnostics was non-COVID, and it collapsed. It collapsed to 2% suddenly within a week. And the lockdown did not allow it to resume for literally 3 months period. And multiple lockdowns, multiple advisories, whom to test and whom not to, and plenty of so-called notices because a lot of administrators wanted to underreport positivity, and also probably were interested in some personal gains. So we had to go to a couple of times to High Court Mumbai to get the review. But these were challenges, but opportunities also were there. Opportunity number one was doing RT-PCR test. We were the first laboratory in the first list announced by ICMR. And we had only a capacity of doing around 200 tests a day. Today we have a capacity to do 10,000 tests a day. So collapse of non-COVID, creation of COVID. So both were last 5 months journey. What we have learned, lockdown is not the solution. Don't keep on repeating lockdowns. For every state, different laws, for every district, different laws. Rapid antigen test is useless. It doesn't solve anything. So we have learned that RT-PCR is the most reliable in COVID diagnosis. What also learned is government labs have contributed significantly, which wasn't expected. We were always thinking it's the private labs which can truly scale up. Government labs too have scaled up and contributed more than 50% of testing. Myth was RT-PCR very costly, but actually it is cheap. Now it has become cheaper because more vendors and more bargaining. Myth, RT-PCR is taking 4 days, 5 days. It takes only 6 hours to report. And that is certainly not a fact to tell that it takes 3 days to report. And what also learning is antibody testing is useful. Antibody testing is useful in understanding how far this virus has exposed our public. How much of public got exposed by the virus. Immunity matters. I don't think lockdown can stop COVID. It is the antibodies which can stop the COVID. And India is blessed. Obviously, only 30 deaths per million in India, where Western world it is 600 deaths per million. The antibody power is seen. If not, we need to find out what's the reason. New normal, work from home will continue. Even in healthcare industry, 70% will be working from home. There will be 2 different religions in healthcare. One is COVID, another is non-COVID. A man with infection will not go to non-COVID. A man with a non-COVID problem will not go to COVID hospitals. The spend on hygiene has to be high for entire healthcare because general public are scared, even medical doctors are scared, and technicians and healthcare employees are scared.